Thanks a lot. I must warn you, it's a very personal reflection on what happened there just during this time. Some people have asked me whether I once would give a talk about that, and I first thought, no way. So the dust has needed to settle for about 2 years, and now it was actually quite an interesting experience to prepare the talk and to reflect on what had happened. And for me, it started, by that time I had been in Toronto for about 4 years. It started during the honeymoon period after wave 1. You remember that in Switzerland at that time they said, we can do COVID now, basically. And I got this email from the dean of the Dalai Lama School of Public Health. It's a powerful public health school in Toronto, of the University of Toronto. Steny has been a Rhodes Scholar at the Stiefel here in Oxford, did first degree in government at Harvard, was like a pillar of science and politics in Toronto and in Ontario. He had been an assistant deputy minister in 2 ministries around 2006 to 10, if I remember that correctly. And he wanted to talk to me. And I didn't have a clue why he wanted to talk to me. And what he said that, we're planning to set up a science advisory table for the government, and I would like you to take the scientific lead. And I said, what? By that time, I had published 5 papers among 500 on infectious diseases. One was a trial in urinary tract infection, and the other were some prognostic models, etc. But I could see I was an epidemiologist, I had clinical experience, etc. And he explained to me the entire story, and I said, okay, I need to talk to Helena, my wife, and to a few friends. And that's what I did, and it was quite interesting. There was, Alison McGeer was there. She was involved in the SARS epidemic outbreak evaluation, etc., at the beginning of the millennium. And she listened to me, and I asked her, Alison, what do I do now? Because she knew just all of that. She said, well, it will be a miserable experience for you, but I hate to break it to you. I think you should do it. And eventually we came to the same conclusion at home as well. And I said, Steny, okay, let's continue and talk. And that's what we did. And the only thing, that qualified me was that I was really impressed by the empty roads in China at the beginning of the pandemic that actually had caused me to set up a prospective cohort study just early March, where we evaluated 144 geopolitical areas in the world that satisfied certain criteria, and eventually it was peer reviewed by the Lancet, but then they didn't want it, and it ended up in the Canadian Medical Association journal. As you see here, we showed, among other things, that yes, when you just look at that and try to carefully control for as much as you can control, given all the limitations, you find that the number of public health interventions is actually associated with control of the virus. That's the only thing that qualified me for the job. Apart from that, I was probably quite good at numbers, and I was an epidemiologist, and I was a journal internist, and sort of had an understanding, perhaps, of what we were moving through. I asked, whether there were terms of reference, saw those, and the most important element in there was what was written there. We provide information, summaries, etc., and these summaries will be published. And something that I told Steny is, Steny, you need to be aware of something I can't do. I can't lie, and I can't dodge questions. You need to be aware of that. For the better and the worse, that's how it is. If you want that, you have me, and I'll try to do this. And we agreed, and I got seconded 70% of my time by the Dalai Lama School of Public Health, meaning I was not a government employee. I still had my job at my hospital, and nobody could fire me. That was important in all of that. Staney sent out an email to all the VPs research, vice deans, etc. Please nominate people for such a science table. It's a voluntary table. There were very few positions that were actually paid for. And then he connected me to a young woman, 23 or 24 years old, Antonina. And here we were, Antonina, 50% of her time, me, seconded 70% of the time, Staney, the political pillar. In German we say Urgestein, you know, like the primal rock, basically just in all of that, mainly just the political understanding, and the vice president of the organization that was responsible for public health in Ontario, that was arm's length of the government, who was about to retire. This was important in a way, meaning nobody could ruin his career anymore, you know. It's really true and important. And we were funded, the few people, meaning Antonina and me, we were funded by a grant that was parked in the Dalla Lana School of Public Health from the Ministry of Health, where a project had run out and there was just still some money left. And that was the agreement between the ministry and the Dalla Lana School to use this money to set up the science advisory table. That's how it all started. So the only other thing I had was access to a graphics designer and a web designer at the Dalla Lana School. So we created or had suggestions for a logo. We created a website, basically, as you see here, and tried to be really transparent. The terms of reference were there. All the members were there. I looked at the New England Journal's website about declarations of interest and then got inspired by that. And we set that up, you know, that everybody had declarations of interest. Everybody was on our website. And we early on just tried to develop a friendly front end. That's, you know, a pilot. When we talked about the role of children in SARS-CoV-2 transmission, how could such a document look like that would be called a science brief, that would actually be informative for both the public and the clinicians and the scientists, etc. It wasn't that easy. And in each of these documents, they went at least as much energy as I typically put into a New England Journal submission, not less than that. No, here we are, you know, with very simple tables that just give you responses to, you know, things you might want to know. Numbers of views, numbers of downloads, of metric scores, a key message, which was short for journalists. We all developed that basically just between the three of us, Staney, Antonina, and I, just, you know, in the evenings or so. And I tried to slowly hand over my job to Bruno, who took over my job as a director of a research center there at interim. And we got started and had a first meeting with the ministry at something they called health coordination table, end of July 2020. That's basically a later screenshot. The web archive was down for a few days, so I couldn't have an earlier one, but it gives you a bit a hunch of the mix. That's scientists, that's senior stakeholders in the government or arm's length organizations of the government. And down here, we have a secretariat of young scientists. All of these people, except for me and Antonina, are not paid. They volunteer their time. Some of the junior scientists later also got paid. And we had a former journalist who was an assistant professor of communications in the Dalla Lana School who advised me on communication with the public, etc. in addition. He typically told me, if this question come up, you need to dodge it. And my response was, Rob, you know, I can't do that. I'm sorry. That was basically the story in there. Now here we are. Wave 2 is happening October 5th, 2020, the ancestral strain still. And the Prime Minister of Ontario says, show me the evidence. And I thought when I read that, you know, I took that personal and thought, okay, we can do that. And it was really relatively straightforward at the time still. So what we did is we showed peer jurisdictions like Victoria, Michigan, as you see it here, ourselves first wave, the actual second wave with projections, and just showed where this is going. We basically showed one of the big weaknesses we had in long-term care homes. This was a disaster in Ontario, and showed what was actually happening there, what was happening in our ICU and in our hospitals. Very simple and very straightforward graphs. And then we distinguish between regions with high transmission, moderate transmission, and low transmission, as you see here. Showed that again, friendly front end, friendly graphs. All of that was presented to the health coordination table. Typically, if we had then also a press release, also to the cabinet by Steny and one other person. I was there very rarely, and then also to the public. We had already wastewater just in one place in Ottawa, the capital, and showed that too. And we had a single case control study, at that time that actually suggested that closing of restaurants or opening restaurants actually mattered. You see it here. But if I would, just discuss this case control study like that, nobody would understand that of those who would need to understand it, including, of course, the government, the cabinet, and also the public. So, Science Communication 101, take your high, moderate, and low transmission curves, apply the odds ratio that you have to that, create a simple bar chart, and publish the bar chart. Here we are. In addition, just make clear that people understand there are associations between the stringency of public health measures. That's the stringency index that was actually created here. You know it, of course, the Oxford Stringency Index. The more red, the more stringent, and they show that it actually matters whether this is red or orange or yellow. What happens with the epidemic curve? And here we are, indeed, an early success. Doug Ford was, got convinced just through everything that was happening there to tighten restrictions in those areas where it actually mattered, including Toronto. So you could think, okay, great. If they start like that, it will certainly continue this way. Of course, it didn't. Only a few days later, or even a few weeks later, we managed then to put everything into words and actually just summarize that also in written form. Remember, again, it really as much energy went into that as in any New England Journal submission I ever did. At that time, I started to realize that this is different from what I typically would do. Typically, I would say, okay, if you don't have your randomized trial around, you can't really tell what happens. But this is different. This is not the stock market where Elon Musk basically makes a tweet, or how is it called now, an X perhaps, and then Tesla crashes, and after that the Nasdaq drops just immediately because Tesla plays such a major role in there. This is different. At the beginning of the pandemic, there is a stochastic element. It's like in a dry forest. If you start to just throw one match and then the second match and the third match all burning, nothing happens first. Somewhere there is then a match that starts to burn, and then the wildfire starts. But after the wildfire starts, after these cases actually take hold, things start to change. And if you have a situation where you experience an effective reproduction number of 2, meaning on average, one person who is infected infects another 2, if you reduce social contacts by 50%, because the virus obviously can't fly, it needs social contact, this means you are actually able, theoretically and very much practically, to reduce the number of subsequent infections from 2 to 1. And that's what we call pandemic control. And you can model that with simple SIR models that are basically just math, but they're probably not so far from the truth. Why? Because you left the stochastic phase. And either I trusted that for the rest of the pandemic, or I would not only get gray hair, but lose my hair probably. And I needed to incorporate that and also try to convey that to whoever I was talking to. That's basically, of course, here, that's, we have seen all these curves. It's very simple models, but they actually, if they're calibrated well, are able to reflect quite a bit of the truth. And that's different from what we all typically do. And if you don't believe that, go back to our prospective cohort study or whatever followed. There were associations, of course. Nobody can, in the end, just prove causality. So here we are, an early success. This seemed to have worked reasonably well with science communication. And then I'm going on Metro Morning. That's, a metropolitan radio show, talk radio show at 7 o'clock in the morning, still a bit tired. And I remember to have heard that there was something communicated in the evening before, and it's about a new traffic light system that the province introduced without, discussing it with us, even though we were the science advisors there. That seemed quite liberal, to be frank, and would not enable us to control wave 2, just not. And here I am, with this radio journalist who is excellent, basically. And he asks me this question there, did you have any input into this traffic light system? And that's really where I crossed the Rubicon. I was there. I did not expect the question coming. And I told myself just within a tenth of a second, okay, you're either now honest or you quit your job now. That's when I was honest. And then I did not leave this line, meaning he asked me, did you have an input into that? And I said, no, we did not. And then he's, of course, tried to, just divide us, government versus science advisors. And I stayed positive with that and said, no, but we can change that. I don't think the system is just mature enough and we will not be able to control the pandemic. But this is basically the moment when I just reconfirm for myself, I either stay honest or whenever I'm tempted not to be honest or to dodge a question, that's when I will quit the job. And that's what I did for the rest of the pandemic, basically. Then we come into January 9th. We just had crested with our second wave because of public health measures, actually. And my colleagues told me, you need to relax a bit, say no sometimes to interviews, radio interviews, and then the TV interviews. It's a Saturday morning, just say no. And I did that. I said no and didn't go on CTV's morning show. And here there was an infectious diseases specialist, no clue about epidemiology, no clue about statistical models, mathematical models, no clue about statistics, nothing, who said, yeah, you've heard this argument before, we probably wouldn't have needed to do that much and whatever. And that was the message. And I felt, okay, we have an issue here. If we want to move some things in this province, we need to have a pincer principle. One part of the pincer is Steny Brown and perhaps others sometimes, and perhaps me very rarely talking to the cabinet directly, us talking also to the ministry, to the health coordination table. But if the other part of the pincer doesn't work, that's the public, nothing will happen, because in the end, we have elected officials and they are dominated by the public opinion. So if I have fools like this guy here, I've given away the sex now of them, just do these sorts of things in the province, no wonder that people actually get confused. This had been the last time I had said no to an interview if I actually could do it during just the entire time of the pandemic. And this hit me then a bit later, just somebody else, because of something completely unrelated, just saying, if you don't do the storytelling yourself, others certainly will. And that's basically what the attitude was just of most of us during this pandemic. We were really concerned, of course, about Alpha coming. We would inherit it from you guys because the pandemic response here had been absolutely, what do I say without insulting anybody? We knew we had a problem. And what we did at that time, we basically just had every 2 weeks on average, we had a press conference that would look relatively official. Just in there, you'll see it in a moment. And the typical schedule would be, we would have 2 90 minutes working session with the entire science table through Zoom. Then I would present at the health coordination table. You see it just up there in blue. And then Steny would give a press conference After that, I would have my first TV interviews explaining what was actually just presented in the press conference. And typically on the next day, I would go on a radio talk show for an hour or an hour and a half and take questions from the audience. That was us just trying to stay in close contact to everybody so that people could really ask, I still haven't understood, why would you, and why has it changed, etc. And do that just as transparently as we could. And you see it here, this was really quite official. Staney, you know, in his stern boxer attitude that he has a broken nose because he used to be a boxer. The Prime Minister actually standing in the background. So we were a volunteer advisory table, but there was something really quite official about us, just in all of that. But we were at arm's length and nobody could tell us what to say. No, that was the real difference. Here, you never knew actually what you would get as a public as compared what the government would get. They knew we would tell them everything that we would have told the government and the ministry before. But it wouldn't be enough if it just would be there just on its own. If I would not then really just go and talk to the public just directly and take questions and be vulnerable also with these questions, because we can't script that. You know, I basically just played the family doctor of the province during these 2 years that I did the job, more or less. And here we were now with what we inherited from you guys. And the red is what then later become known as alpha, you know, that just goes up just anywhere. But people lacked an understanding of that. It was basically too abstract, you know, we just have peaked, our second wave is gone. Why should we worry? What do you talk about these weird red dots in there? How do you communicate that to everybody that things are actually changing? It's simply too abstract. No, it's too abstract what's coming, simply too abstract. So I tried, you know, and others tried as well. So early January or mid-January 16th, I said, this is the single most scary thing I've seen on radio in a long, you know, just a talk show since the beginning of the pandemic. You know, we went out just everywhere, just to try to convey what's happening. Remember, we had all these press releases as well that came. Later, I started to talk about the pandemic. Within the pandemic, we still had the problem that the current variant was masking what was happening with Alpha. That was just coming. I had to start earlier, much earlier, just to be, you know, feel confident enough just to start to explain the pandemic to myself. We had a setup where we basically got real data every day, real-time data every day. And I started just to develop an Excel sheet with all sorts of things on there. And that was the moment when I felt, okay, we need to just put some of that, not only just to explain it to myself, but also to others, just onto a public dashboard. And we started to have a public dashboard explaining now, as you see it here, you know, the new variants of concern to the left. That's the wall that goes up, whereas the early variants come down. And when you combine that, then it doesn't look that dramatic, that people started to understand what was happening. No? At the same time, we just felt, oh dear, vaccines are coming. Let's see what we can do. So, you know, take the first trial coming out, you know, the Pfizer vaccine, and read in the time to event curves. What's actually happening between the first and the second dose? Can we actually derive just by reading this in, can we derive vaccine effectiveness of one dose? Because we don't have enough vaccines. So we did that, you know, and developed a rollout strategy where we said, okay, the effectiveness of the vaccine in preventing symptomatic infections there is 85% after one dose. So let's run with one dose rather than with two. And if you observe long enough, that's basically what you see in terms of a difference, you know, between the orange bar and the blue bar over time. And basically the province decided to run with one dose rather than, you know, just using the second dose after 3 weeks, as my Swiss colleagues had to deal with, for example. Then we had another aspect, which was that the pandemic was actually just centered around Toronto and a few other places. And of course, it was a function of socioeconomic status, obviously. So a colleague who worked at Public Health Ontario saying, actually, we have this wonderful, you know, 6-character postal code. let's take the first 3 digits plus age, the year of the age, and just combine that and just ask, where do we see people ending up in the hospital by age and by postal code? And what we basically developed is a strategy just to basically just ski down the Swiss ski hill with your vaccine rollout and say, you start at the highest risk, and people, the only thing they need to tell you is where do they live and how old they are, and they know exactly whether they can get the vaccine today. So we developed this part. And then you remember we had the problem with long-term care that was tremendous. So we just tried to show what's happening if you basically just increase your speed and put all your eggs into one basket and actually just vaccinate residents within 2 weeks rather than within 6 weeks, how many lives you actually save. That's the sort of things we did in addition in there at the beginning, and this worked relatively well. And remember, we did all these press conferences, Steiny Stern, you know, just in there, unlike me, you know, just I was more like the Swiss lumberjack, and he was really stern and politically correct. And, you know, that would be the next few update on COVID-19 projections there. And we are now on March 11th. And that's how we're sitting there. And after his presentation, the TVO reporter, John Michael McGrath, asking, am I missing something here? Or is this presentation actually predicting a disaster? Still nothing has happened by then. And Steiny pause. And finally the answer, no, I don't think you're missing anything. And this was like, this became iconic, you know, in the province, basically just this response at that time. Meanwhile, we're at March 24th. We're in this 2-week, you know, 2-week intervals of press conferences. That's the producer of Ontario Today, this live talk radio show with phone-ins. So she asks me, are you able to share with me what's coming tomorrow? And my response, things a bit complicated. Are we at the hair on fire moment? I see numbers climbing and outbreaks, you know, being a good journalist there. And I don't respond immediately. Remember that timestamps are for the UK, but this was 5 hours, minus 5 hours for Toronto. So in the morning early at around 5, shortly before 6, I tell her that there won't be a presser because I just learned it as well. No press conference this week. Thank you. So things will probably be different. We will have a science brief. Let's plan for Monday then. Okay. But will you give me a sense of what's happening, what's coming? We needed to really work with them very closely. I have about 30 or 40 journalists that I just was texting on an ongoing basis all the time, actually, just in the province. And I've told her, yep, I can give you some hunches there. Thank you. Great that we can plan. But, you know, and then she's coming next morning. Remember, that's 10 to 6 in the morning. I received this message. I see news reports with much of the detail. Oh, something leaking? No clue. Just heard from CTV News, you know, somebody calling me at 5 to 6, telling me the same. Here is the article that's coming in, you know, that basically is just our leaked science brief that we have. It's leading the news in Toronto and nationally on World Report. Somebody leaked, not us. Will you adapt your timing as a result? You know, I don't know. What do we do? I need to start to talk to my people. They need to start to talk to their people, etc. Will you talk to us, you know, in Ontario today, because it's news now? I think the genie is out of the bottle. Do it now, because then you tell the story, not somebody else. Give me a few minutes. Okay. Can we confirm for noon? I need to be able to tell my host. Give me a few more minutes. Probably. Thumbs up. Can you say yes, given the press conference that hey, we have decided to talk, etc.? Yes. Just got clearance. Excellent. Here I was, you know, just 3 hours later, talking with the people exactly about what was leaked. You know? That's the way this actually worked in there. On March 29th, so 3 days after that, we then finally published this report showing, for instance, your data on ICU admission and death, you know, a good old meta-analysis on severity, hospital admission on Denmark, showing that deaths occurred later in the process as well, not only early as with the variant before, and showing that last time when we had a stay-at-home order, you know, was where you see it there, the province-wide lockdown to the left, and we actually had really reached these points again, and nobody did anything. Still not. No. We could vaccinate, of course, but you can only do that, you know, as fast as you can. And here we are. We weren't there that we had vaccinated enough people, and they kept preaching we can't vaccinate ourselves out of this third wave. We need to do something in addition. You know, I became rather blunt, which again created quite a lot of red heads when I said that the pandemic is now completely out of control. And, you know, this again was just in every radio and TV station, just in the evening. And but this was the story. So here we were just had crested. You see the out of home mobility that we also always presented on our dashboard. That was accessible to everybody. Here we had basically just put the first red flag up, also in a press conference. Alpha is coming. We have a problem. We should not decrease public health measures. Look at the stringency index. That's the blue line. The next press conference, things go down. You know, you basically just try to break, but you can't do anything, and you know what's coming. The next press conference, we keep repeating always the same. The next press conference, that's the one where Steny said, no, you didn't miss anything, basically. Here, the science brief was leaked, and we made all the headlines that I've shown you. And then they started to, you know, do something, which was very, very late in the process. And meanwhile, we are here. There was a stay-at-home order basically 5 or 6 days before, but the pandemic doesn't react that quickly. It's like the Titanic in front of the iceberg. It takes a while. And we're basically now, you know, having a situation where never as many people have been in the hospital and never as many people in the ICU in our province as to this time. And we're basically briefing everything. That's one of the only times I also briefed the cabinet directly, not only the health coordination table, but also the cabinet. And I knew what was happening in there and what we were communicating. One of the problems we had was, as I've shown you this map before, we had an issue, especially in the red zones. And that's where the Amazon warehouses are. And nobody there having paid sick leave. So people, if they got ill, they basically would continue to go in and infect others because nobody paid for their time and their paycheck would not be enough if they would not go working. And we tried to move the Conservative government to actually have a paid sick leave and discuss that extensively also during these briefings. And here we are, April 16th, and the decision is we close playgrounds and introduce police controls. And I was at the briefing before and I felt, what did we just communicate and what's coming out there? What's happening? And that's the reaction in our analogous to the Guardian. Look at that. That's all physicians just speaking up. Physicians in leading positions speaking up very bluntly, and that was the front page of the Toronto Star at the time. What I said there is down there, closing playgrounds and golf courses and tennis courts just shows that the epidemiology of the disease is not fully understood. I was tame. But look what some of the other people said, basically. That's how closely we all were together and we really acted as one force, the clinicians, the scientists. There's even a PhD student up there who speaks up, who is on the front page of the Toronto Star. Really, that's how it worked, no? They really got bad press for all of that. What really got to me is, you know, is this statement. When Ontario Premier Doug Ford announced the current stay-at-home order on April 7, he said, province's COVID-19 crisis had become worse than predicted. You know, this sounded like really absurd, given what we actually had experienced. However, At exactly that time, luckily, we could not predict that. The public health measures with the stay-at-home order actually kicked in. The first vaccine doses helped, and we actually destroyed alpha just with the vaccine rollout, plus a little bit of public health measures then staying just after that, including also, 14 days later, roughly, then hospitals peaking, hospital bed numbers peaking and going down, as you see here. So now we are before wave 4, Delta coming now. So, okay, I was thinking again, what can we do differently this time? Things had changed mainly because they got under so much pressure. But what we did basically is, we again just were communicating how this goes with evolution and increases in transmissibility at that time, times 1.5, and then again times 1.5. And the original virus is not only infecting much less people than what we're having now with Delta, but it also just resulted in much less people in the hospital than what we're having now. So we better be prepared here. That's what we try to show. And then simple maths. Okay, what happens with an early strain, with Alpha and with Delta after 15 days? It does matter, whether transmissibility actually increases. That's the slides I kept showing, to different stakeholders. What happens then cumulatively? Yes, after 28 days, you're at 60,000 if you start with one Delta virus and just let it go uncontrolled for 28 days, but only 5,700 for Alpha, etc. You get the flavor. That's basically how we try to convey exponential growth. And it didn't need much. Basically, there was a reaction just coming, directly, relatively early. Okay, we slow down our reopening and see what's happening. What we also did, again, based on very preliminary data, made clear now probably the second dose is needed. So we basically timed our second dose to the Delta wave, vaccinated again as fast as we could, everybody as completely as we could, and look at what happened with our Delta waves. We hardly had any, nothing. And the only thing we did was a little bit of masking, a few capacity limits, and life was going on. It was basically the second dose of the vaccine, a bit of masks, a bit of capacity limit, and it was just a nice summer and autumn, and it was just okay. And that's now just, evolution in real time, this shift from red, that was the original strain, to blue, that was also on our dashboard, which was Alpha. All of a sudden, it goes up again, just the different markers again being prominent. That was Delta. And now, here we are. Now we're at the beginning of Omicron. And of course, Omicron really destroyed everybody's party, as we know. So here we are. We gave an update, again, the same graphs as before, just unmasking what's happening with Omicron as compared with Delta. And then, this part, you remember the narrative, it's not a problem anymore because the virus is mild. You heard that again and again. We don't have to do anything. And that was the big battle we just had to take there, just to show, wait a moment, when you look at what's happening even in South Africa, where the median age is 27 years, in Ontario it's 41, where most people have been infected. By the way, many people have died, etc. That's not us in Ontario, where we had a tight pandemic control, trying to get this across and show them there's a wall of cases in South Africa, and there's actually also a wall of people very early on just ending up in the hospital. The only thing that seems to be different, luckily, is that they have less deaths. But remember, South Africa is not Ontario. And, what we need, and everybody was tired, we need what we call the circuit breaker. We need just a few weeks' time to now just get a third needle into people's arms and have people relax, not do that much, just, stay at home most of the time, etc., wait for their vaccine, that we are actually able to survive reasonably well this part of the pandemic. But everybody was tired, of course. What you see in yellow is the number of the interviews I've given during this week, okay? So we are here now. That's Power and Politics there. That's one of the prominent TV shows with a really capable journalist and host, Paul Hunter. Basically, he tells me there, and I'm really tired, you know, after these 45 interviews. It's just you always explain the same thing, just everywhere. I'm really tired and exhausted. And he tells me, but Dr. Jüni, we're all tired. We can't anymore. And they're telling us we now need a circuit breaker. And I said, yes, I'm tired too, actually. I can't be bothered either. But, and then I made a big mistake. Huh? I said, but still, we need to stop moaning, face the reality, and do the right thing. You know, what do you do if you're on a beach and the tsunami is coming? You say, oh, there's no tsunami. No, you can't. You run. That's what I told them. And I left this interview and said, oh dear, this probably was not good. But it was too late. It was out. It was on live TV. And, you know, typically I would get these emails of, you know, thank you, Dr. Jüni, for this or that. I just heard you on the radio, whatever. There was a steady drop in of emails like that. All of a sudden, I got death threats. And I thought, but has it been that bad? What has happened? And then I saw that, you know. That was, you know, tabloid press, like here, what is it here? How is it called here? The Sun or something. Tabloid press, science table, top dog, arrogant bastard, tells restaurant workers to stop moaning. I never said that. I said, we need to stop moaning right now. But of course, I gave him a weapon. And, you know, the arrogance and utter lack of compassion that some parts of the expert scientific community have. Obviously, Brian hated me by then, the journalist. That's then what happened next, you know, and what it meant for us is, you know, so what I then got was just increasingly challenging. We had police, etc., etc. We basically accepted the offer of one of our colleagues from the science table and went to for the Christmas, etc. Went just to his cabin up there and just basically just waited it out. And after about 2 weeks, it had settled again. But I made this big mistake. This was the single most, you know, dominant mistake I made during this pandemic. I just should have used different wording. That's all. But I gave tabloid press a weapon, and they just used it this way. Not finished yet, not quite, just to show you on how little evidence we sometimes were striving. So wave 5 still didn't work with the vaccines anymore with just 2 doses. You know, vaccine protection just went down. That's our real life prospective cohort study. So every day on the dashboard, people would check what's happening with vaccine protection, what's happening with this or that, and there would really be many people who actually were looking at that. Remember, behind that was just my machinery of an Excel sheet. It still exists. That we just did screenshots just for this dashboard. The problem was just 3 weeks before we had told people there's a good way to use rapid tests. Do that. No, great if you sometimes use rapid tests and just play things a little bit safer. But then a Swiss colleague, Isabelle Eckerle, tweets, hey, doesn't seem to work anymore. It's now December 30th. Look at that. It's based on 10 people. That's all we have. That's the evidence. Lab study with 10 people, all vaccine breakthroughs. What it basically finds, you know, just the little piece she's just producing there is that the sensitivity of rapid tests just go down. And it's April 30th. People are tired, and we're before New Year's Eve. So what do I do? That's an investigative journalist of Toronto Star. Kenyon, there's new data on rapid testing. Are you working? No, we might be able to spare a few minutes. Then we call. That's how it works. That's how the work ethics was among journalists there. You know, less than 10 hours later, he tells me, here's the story. Swiss research adds to the reasons you should be leery of negative rapid tests. I take that, text the producer of, you know, the evening news on CBC. and discuss exactly the same thing just before New Year's Eve with everybody. Just don't trust rapid tests. The evidence I had was a tweet with 10 people just showing the rapid tests don't seem to work anymore. It took us, after that, 6 weeks to actually just sort everything out. By then, we had multiple preprints, all showing the same thing, just to establish, yes, indeed, they did not work anymore. But I just made an executive decision. I don't want the pandemic to explode more. If this is really true, we need to call it a day, and therefore I went out with it. Now here we are. That's the last set of slides, January 6, 2022. That's the wall of hospitalizations we have, because not much has happened yet, or we don't know yet. I'll show you in a moment, actually a lot has happened, but not at the level of officials. We tried to vaccinate as many people as we could with third doses. That's in yellow, but it takes some time, you know, not that much has happened until 6th of January 2022 yet. And you see that the reaction of the government was slow when you look again at the blue curve, which is the Oxford Stringency Index, but something else has happened, and that was new. When we went out on December 16th and just said, we have a problem again, it's massive, and we should all stay home, people spontaneously stayed home. Look at what the out-of-home mobility did there. They did that without anybody except from, you know, us going out, telling them or asking them or requiring them. People just stayed home in the province on themselves. And it took until the 6th of January until the government actually fully reacted. Did this impact or not? That's the big question. You know what happened there? When I looked at it, it touched me and it made me hopeful. You know, when we were monitoring that, that's based on Google data. We basically just could update that 3 times a week or so. But we had a problem, of course. We didn't have an early indicator anymore because the testing system had collapsed completely. Luckily, that was one of my first things I did when I talked to the health coordination table in Ontario. I told them, showed them a study, you know, coming from the US that calculated that the cost of reagents to test once 15,000 wastewater treatment plants in the US and cover 70% of the population in one day would cost 10,000 times less than the reagents to test all these people. And they took it up and told me, Dr. Jüni, that's a great idea. And we built up a wastewater treatment system, and this was in place by then. Only we hadn't made optimal use of the data. So what we basically did there, I just collected all the data, and I first played with it myself and was able by January the 7th to see that the effective reproduction number would be approaching 1. And then I called Bruno and told him, Bruno, I need your help. We need to do the same that we do when we do osteoarthritis research with all these crazy pain scales that are all different. Let's standardize the wastewater signals in all these treatment plants, and then let's put splines on it, that's some stats, it doesn't matter, and then do a simple inverse variance fixed effect meta-analysis, you know, within each public health unit. The province was just organized in public health units, and combine that by using population weights across the public health units. And that's basically what Bruno did with loads and loads of code, pages of code. So here, that's the standardization and the restricted cubic spline for one individual gene in a wastewater in one treatment plant. That's basically the inverse variance meta-analysis in a public health unit. And that would be what you would see if you combine all of that in a region using population weights. So the big question is what has happened and what we could show. And I could show that for the first time to everybody on January the 14th is that thanks to what people actually did without public health measures, on January the 5th, the wastewater signal had peaked. And sure enough, 18 days later, hospitalization peaked, and we made it. That's wastewater signal later, and what you then really see is this transition into endemicity. That was behavior of people, not public health measures and vaccines and infections, and then public health measures, infections and vaccines that contributed a bit more to the steeper downhill slope. Then we let it go, opened up, and the next ones were just controlled by infections, and we slowly but surely, and perhaps sometimes rapidly, made it into something which looked more like endemicity. Was it all worth it is, of course, the question, what we did there. So let's first have a quick look at our southern neighbor. We share 1,700 miles of border with them. So that was our hospital occupancy in solid red versus what happened in the US, up to May 2022. That was ICU occupancy. These were the deaths. And remember, it wasn't that much, actually. It was, we had an issue, which was school closure, which was a real issue. We couldn't keep the government convinced that they should leave schools longer open. That was probably the major issue we had. But you could do something there just with a coordinated action. I don't have the data just in a comparison just for Ontario then further, but my successor, Fahad Razak, did the same for Canada compared with the G10 countries. Since we are the biggest province with 14.7 million people, we're roughly at the average that you will see. Up here is the United Kingdom in terms of cumulative confirmed COVID-19 deaths to the left and excess mortality to the right. We are down here. That's the difference it can make. And it wouldn't have worked if we hadn't all just worked so well together. And the role that the journalists played there was just absolutely invaluable and incredible, actually, what they were doing. So conclusions, speak up, but don't become an epistemic trespasser. We had a lot of hobby epidemiologists out there, infectious diseases degree, but nothing else, and then whatever. You need to triangulate evidence to a crazy degree. And remember, I actioned something which was basically a tweet based on 10 patients. And I actioned it, and I felt it was the right thing to do. And what is most important is this only works if you stay credible. And this means you can't lie, you can't be selective with your communication. And the public really needs to trust you that you don't bullshit them. Thanks a lot.